Hello, Professor Pins and friends. Welcome to our project on periodontal gum reconstruction for oral health. My name is Sammy Hankowie.
I'm Erin Gawoski.
I'm Alona Lakovnikova.
And I'm Elizabeth Lynn.
So the problem we chose to focus on is the issue surrounding periodontal gum and tooth decay. In individuals that are over 65, in fact, 20% have untreated tooth decay and about 68% have gum disease, leaving a large market for individuals that have issues with their oral health, especially with old age. There's a huge need for proactive and preventative measures that facilitate gum restoration and reattachment to loose tooth fixation that would decrease overall recession ahead of time and the benefits of overall patient health in the oral cavities.
So our approach utilizes the pinhole method pioneered by Dr. Chow, which has usually collagen strips, but we propose a bioinductive scaffold composed of stem cells that will then be inserted into the gum line and ideally facilitate reattachment of the tooth to the bone and to the gum. The composition will be primarily of mesenchymal stem cells and type 1 collagen, and will also be supplemented with epidermal, fibroblast, and platelet-derived growth factor, as well as bone morphogenic proteins. For the procedure, as I mentioned before, we will be using the Chow pinhole method, where a pin is essentially injected into the patient's gum, and a tilted syringe is injected full of a paste-like scaffold material and injected wherever the tooth decay is going on or any other issues with the gum where the surgery is necessary. And we hope to then facilitate tooth gum tissue regeneration as well as the growth of new periodontal tissue.
So in terms of the benefits, there's two key benefits that our solution does, and that is the clinical benefits are the main ones. So that's decreasing recovery time, decreasing tooth sensitivity and discoloration. And it's also less painful for the patients because there's no graft required, and this is a very minimally invasive procedure. And we expect that with our solution, molar restoration will be able to withstand up to 1,000 newtons. And the second main benefit is an equitable benefit. So since you're using stem cells, this makes the procedure unique to each patient, and you don't have to worry about any discoloration depending on the patient. In terms of cost, the Chow pinhole surgery has an average cost of $30,000. Our method is a little more expensive. The bioinductive scaffold that we plan to use has a total cost of $5,300, and that plus the surgery would make it $8,800 per patient. And although this is more expensive, we do think that the benefits outweigh the cost in this sense.
All right, and moving on to competition, starting with tooth restoration. Current solutions consist of dental crowns, dentures, and dental implants. These are all non-absorbable solutions to the problem and sometimes require shaving down teeth or breaking down existing healthy teeth, which is not a sustainable approach. Moving on towards gum restoration, current solutions consist of gingival grafts, connective tissue grafts, and pedicle grafts. Gingival grafts, they're grafts where you take a small portion of tissue and relocate it somewhere else in the mouth. Connective tissue grafts, they take a larger volume of tissue from the roof of your mouth and place it somewhere else to restore even more volume. And then pedicle grafts are flaps that are pulled downwards to help with its aesthetic effects. So moving on to the gold standard, which is the cow pinhole method that we alluded to earlier. This is something we want to build upon and improve with our solution, our injectable solution. We plan to use academic research to kind of be the main driver of this innovation, utilizing both enamel matrix derivatives and stem cells to hopefully restore gum volume and also periodontal bone tissues. And then here are our references. Thank you.